Wellness Show. I'm Dr. Keisha Christian, your host. So glad that you've tuned in for today's episode. Today is going to be a sequel from last episode. Last episode, many of you have seen that episode, and it was about injury prevention, where we equipped you with just some simple tips that you can take with you in preventing injury. Because we talked about that an injury can change your life. It could be a small injury, and it could be something extensive that can really consume and change your life. So we wanted to equip you with just a few tips, a few steps that you could take to prevent an injury. So take a quick look at a glimpse of last week's episode, and then we will catch you up on this week's episode. Stay tuned. Definitely warm your muscles up before you go out there. Also make sure that you're well fed, well nourished, and you're prepared. Make sure you're not tired as well. If you're fatigued or you're worn out, your body is not going to function the way that it should. So make sure that you're well aware of what your physical status, your mental status, and that you are ready to perform an activity. Make sure you're equipped with the proper, whether it is protective gear or you're warm to stay warm. And so it's important to employ that so that you are practicing injury prevention, and then also you're taking care of yourself, mindful of the best technique to do it as well. You've got to know your limitations. So again, when you're practicing injury prevention and all the various activities and sports-related activities that you're doing, know when you need to stop. Don't continue performing an activity and making it worse. Our bodies, our physical being, is connected to our brain. So our brain knows when injury occurs. There's a physiological process that takes place to notify us that, you know what, ouch, that hurts, and I need to stop, or very much so proceed with a lot of caution and maybe change what I'm doing, or just completely stop what I'm doing and pay attention to where I'm hurting. Because again, something minor, a little ouch, can be a big ouch and cause a lot of problems down the road. So let's just review an injury prevention. So we talked about number one is making sure that you warm up your body before you're performing any activities that may be foreign for you, maybe that you're not familiar with doing for a long time, or even if it's just a couple weeks. It's always best to warm your body up and make sure that's important when you're engaging in a little bit more than what you normally do on a day-to-day basis, just an everyday casual function. So warm your body up. Make sure that you've had proper rest. Make sure that you've fueled, you've provided your body proper nutrients, that you are hydrated. Make sure that you know whether it is you need to have protective gear or not. If you need to have protective gear, go ahead and throw it on. Put it on and protect yourself to the maximum way that you can. Also, make sure that you know the proper technique and handling either machinery, equipment, or various devices, or if you're doing a sports-related activity, make sure you know the proper techniques in performing that sport-related activity. When you are doing activity, take occasional rest breaks. That's very important. When you are training, make sure you do more of a moderate type of activity as opposed to a high throttle of activity, high burst of activity. That can cause a lot of problems and also be a predisposition for injuries. And then also make sure you stretch. A good flexibility and stretching routine is so important. We generally recommend to stretch after you perform a sports-related activity or any type of activity. So again, it's always important to warm up, then engage in that activity, so warm up, and then slowly ramp up your activity level and try to maintain that moderate level of activity while you're still taking breaks and rest periods between that time. And then after, have like a cool down where you're slowing down your activity. And then finally, stretch. Go ahead and stretch those muscles and those joints out. And if you don't know of a good stretch routine, you can certainly either ask a trainer, your coach, a physical therapist, someone who is well knowledgeable in stretching and how the body mechanically works. And that's really important. Stretching is very important. I would love to get $1 from every person that says, I know I need to stretch. I know I need to stretch, and I'm going to start. And then they don't start. Whether it's the technique in performing an activity or whether it is the best way to perform a sport. We want to work smarter and not harder. And there are various coordinated tasks that we could do to work smarter and not harder. Sometimes there are people that perform activities that may take 3 different tasks when it really could be done in one task. Or it could require just one body part, but yet they're using all of their body parts to perform the task. So inquire with someone who is knowledgeable in that particular area, who has done it before, or if you have a coach or a trainer or a physical therapist, it's important to ask, what is the best or the proper technique in performing that? We are energy conservationists as physical therapists, so we're going to show you the best way to perform an activity that is not going to recruit more muscles than necessary, as well as it's going to perform the task efficiently and prevent injury. So always ask. Always ask. People say to me, you know what, I don't want to ask because, people might think it's a dumb question, but, there's no dumb question, number one. And number two, if you don't know, it's better to find out for someone who is educated in that area or has experience in that area so you can protect yourself as much as you can. And who knows, maybe tomorrow or down the road, someone may come and ask you, and you have the knowledge and the skill that you can share with someone else and prevent them from getting injury as well. So another recommendation in preventing injury is that you want to train when you're doing various activities. So let's talk about sports-related activities. You want to train moderately over a period of time. Studies have shown that when you have spikes of hard burst activity, that can be a precursor or cause an injury because your muscles aren't really prepared or they're not well ready for that particular activity. So it puts that increased stress on our body and can predispose us to injury. And also, you want to take occasional breaks, whether you're doing an activity of some sort, either in the yard work, or helping someone move, or doing a particular task that you haven't done in a while, whether it's playing pool, or whether it's playing disc golf, or lacrosse, or basketball, or football, or whatever activity it may be. You want to certainly take some breaks, right? You don't want to go out there full throttle performing an activity and end up injuring yourself. So take breaks. We've seen it, right? We've seen hockey players and soccer players. They go out for a while and play and engage in their sport, and then their coaches will bring them back in. Even if it's a short period of time, they'll bring them back in to take a break so their muscles can get a break. Lots of information, isn't it, as far as injuries and how just doing simple things every day can be a precursor to an injury. However, again, there are some tips, as seen in last episode, that you can take to prevent injuries. So today, moving on, what we want to talk about is if you've had an injury, then how you can take care of that injury. So again, it's a sequel to last week's episode. So if you've inevitably had an injury, the first stage that you're going to experience is basically pain. And then you're going to have some swelling, and then different symptoms and signs progress from there. Now, if you're in a position where you've had a minor scrape, burn, or even an injury such as a strain, which is the muscle being pulled, or a sprain, a minor sprain, where you actually pull the ligament, it gets overstretched, then there are some simple tips that you can do. And you may be by yourself or in the presence of just a few people, but if you don't need medical care, and you're able to take care of your body, then what you can do is something simple as what we call RICE. It's an acronym that we use in the healthcare environment so that you can remember easily of some simple steps to take. So you have RICE, which the R stands for rest. You certainly want to rest from any activity or anything that causes that area that has been injured to be re-aggravated. In the first 48 to 72 hours, that's recommended. And then after that time period, you need to understand whether you should not do that particular activity that aggravates that area, or whether you should proceed with caution, or if it's okay to slowly but surely, gradually get into that activity level. So rest is very important. Resting from the activity, resting from anything that aggravates the activity. Sometimes people say no pain, no gain, and that's not always true, especially if it's an acute injury or trauma that's been inflicted on the body. You want to make sure that the healing process starts and commences fairly early. So rest is certainly important. And rest may be, again, not doing the activity, or sometimes you have to rest and either sit down or lay down or be immobile or inactive. And it depends on what type of injury or trauma you've experienced. So it's very good to speak to a healthcare provider to determine if it's necessary to stop an activity altogether for greater than 72 hours, or if you can slowly but surely gradually increase your activity. So rest is the first part of RICE. Then you have ICE. It is so imperative to apply ice to an area that has been traumatized. The main reason being is because when you have a traumatic experience or an injury, heat is going to naturally gravitate to that area that's been traumatized. So you have an influx of heat that goes to that area. That's our natural body process to compensate or to know that there's something in that area that is going on. And that's why it's good to apply an ice pack. I stands for ice in most cases. apply the ice pack. I usually tell people apply an ice pack for about 15 to 20 minutes. Not too many people like ice, and yes, I wish I could have warm ice. I need to try to invent that warm ice so you can put that on. It could still be beneficial, but you don't have to feel that cold. Yet, it's important to make sure that area is nicely cooled down so that it helps to prevent inflammation from getting more and more cumulative in that area. So the ice constricts the various structures that are in that area, the blood vessels, the muscles, the tendons, and so forth, so that it can slow down the trauma that you've experienced. So that's why ice is very important. And in terms of ice, we do recommend that you continue to use ice frequently throughout that day and the next 72 hours that you've had the injury. So you can put the ice pack on for about 15 to 20 minutes. You can take it off and then apply a fresh ice pack on it as well after a while. And that's really important to, again, constrict the area, prevent swelling to accumulate to a level that we can never get rid of, and just to contain the injury and make sure that it can start the healing process. So remember, ice for at least 48 to 72 hours, and then after that area is cooled down, it may be a little bit more than 72 hours, or where you can transfer to not applying anything or actually applying some heat to that area. What heat does after you've taken care of the initial traumatized area is it can help loosen up the area, help to heal the area, as well as allows you to have a little more range of motion. Let me give you an example. Say, for instance, that you injured your knee and you were playing a sport, perhaps playing soccer or football or baseball, and you injured your knee. For the first 48 to 72 hours, you want to make sure that it has good contact with an ice pack, and continually use the ice pack throughout the day and up to 72 hours, and sometimes even greater than 72 hours thereafter. After that point, it's important to assess that area and determine if you should apply heat to loosen up that area, or you should just go completely without applying anything dealing with temperature on that area. And then it would be good to perhaps consult with a healthcare provider, a trainer, or your coach to know what you should do at the next stage. So we talked about R for rest, we talked about I for ice. The next is compression. Whenever you have an injury, it's good to put an ACE wrap or some type of wrap around it to compress the area. And again, that also contains the swelling, number one. And then also when it starts to heal, scar tissue, the scar tissue that comes in and actually starts to heal that area, helps it if it's compressed. It will speed or actually accelerate the healing process. So you can either use an ACE wrap is good. In some cases you can use tape, like athletic tape or medical tape. They also have rock tape, which I like. I use that quite a bit with my clients in terms of when they do have injuries, whether acute injuries or chronic injuries as well. And also some areas may require a brace where it actually immobilizes the area to prevent any type of activity from occurring at that area. Last but not least, we have the E, which is elevate. Elevation is very important as well because that helps to prevent the swelling from accumulating. You've heard me talk about swelling various times, And with swelling, if you have an increase in swelling, unfortunately, that delays the healing process. So we want to get rid of swelling as fast as we can. And so that's why it's good to elevate. Now, some people always ask, well, how do I elevate, or how much do I elevate? You always want to elevate higher than your heart. So if you're laying down and you're elevating either your shoulder or a leg or your arm, always put several pillows underneath that affected area so that it is actually above your heart. Because you also want it to recycle the blood flow throughout our body. So it goes back through the heart, back down to your feet, and then recycles naturally through our body without accumulating so much swelling in that particular area that was injured. So that's really important as well. And then, of course, when you utilize the principle of rice, you're going to prevent that injury from progressing at a faster rate. You want it to de-escalate the injury process, but to accelerate the healing process. And rice will certainly do that. It will help you get back to functioning on a day-to-day basis, doing the various daily activities that you need to do at home, at work, at play, or even in your sports-related activity. And then if you have an injury that needs medical attention, make sure you try to get that medical attention as soon as possible. That is critical, because if you delay that medical attention, what can happen can really direct the recovery or lack thereof of that injury. So if you get that medical attention and they guide you and direct you and take proper care of the injured area, you're apt to get better as soon as possible. But unfortunately, if that is delayed, then it may take longer for that area to heal. And then it can become a chronic injury or an issue or trauma, and it could lead to other issues and problems and that you don't want. One of the issues that can be caused is down the road is you can be predisposed to arthritis at a premature time period. Arthritis is basically when you have inflammation as well as deformity of a joint. And what that is caused by is sometimes when you have an injury and then perhaps it hasn't been restored to its normal posture, or the joints become stiff, the muscles become stiff, or there's excessive inflammation or swelling that accumulates and just camps out there in that particular joint or area, then it can prematurely cause arthritis. So it behooves you to actually stay focused, stay on top of taking care of yourself. When you have an injury, make sure you're taking care of it, doing everything that you can do. Practice the rice technique, rest, ice, compression, and elevation. Seek medical attention either from your primary care physician, a specialist, or a physical therapist or your coach. What physical therapy can help you with, in that I'm a physical therapist, what we can help is we can evaluate that area and determine whether you need to have more medical attention, whether you need to go see a doctor or you need to have x-rays or other diagnostic tests to see and make sure that everything is structurally sound at this site of where there was injury. If not, and we can actually take care of you before you have any other requirements, then we can certainly do that. With our techniques of evaluation and then also treatments, we have so many tools in our toolbox that we can treat you with to ensure that your inflammation in the areas reduce, that the posture of that body part goes back to its normal state and form, as well as your mobility is restored and your strength and conditioning is also restored, because that is so important. Balance in the body is so important. We were made fashionably, and it's so interesting how complex our bodies are. And you know, it's so true what they used to say. I don't know if they still say it, but when I was growing up, they always said it was connected to your shoulder bone, and various bones and structures are all connected. And you know, there is a lot of truth in that. Everything is connected and they are interrelated. They rely on each other to function properly. And if there is some form of disconnect, then things or areas in our body do not work as efficiently as they should. So we want you to be balanced completely. We want to encourage you to, number one, prevent an injury by making sure you're taking care of yourself and practicing those principles as we discussed earlier. And then number two, if you have an injury, is ensuring that you are taking care of the injury. The first few hours of having an injury is so critical. So making sure that you take care of yourself is so critical to how that injury is going to heal and progress, as well as be completely restored. So that's so important. So it is vital that you continue to take care of yourself. And I always say that it is recommended that you continually move. Our bodies were meant to move, stay functional and move. Stay flexible first of all. It's important to keep those arms, those legs, and your torso nice and flexible, almost like a bionic man or woman, and then also strengthened. You want to stay strong so that everything works in sync and coordinated with each other. Maintain your balance, maintain your coordination, and just that you as a whole are balanced. That is so important and critical. You do that, you will live a life of wellness, not only today, but years to come. And thank you for joining us on the Wellness Show. And as always, we wish you well.